What I'm about to show you may completely change the way you look at the most ordinary pill in your medicine cabinet. Because there is a medication millions of older Americans take without fear, without hesitation, and without ever being told that under the wrong conditions, it can quietly push the heart toward real danger. Not in some rare exotic case. Not in some hospital-only scenario. Right at home. In the kitchen, in the bedroom, next to the coffee maker. And by the time I reveal the most dangerous part of this story, you're going to understand why so many adults over 65 never see the problem coming until their blood pressure climbs, their ankles swell, or their breathing starts changing. And here's what makes this so disturbing. One older adult is taking this pill because their knees hurt, seeing a little relief and assuming everything is fine. Meanwhile, another older adult is taking the exact same pill every day and slowly making it harder for the heart to do its job. One person ends up with blood pressure that suddenly won't behave. Another ends up short of breath walking to the mailbox. Another thinks they're just getting older, when in reality their medication routine is pushing their cardiovascular system in the wrong direction. I've seen this pattern more times than I'm comfortable with, and most of the time the pill isn't being used with bad intentions. It's being used with false confidence. I'm Dr. Michael Joel, and if you're over 65 or you love someone who is, you need to stay with me for this entire video. Because this isn't just about pain relief anymore. It's about how a very common pill can raise pressure, trap fluid, interfere with heart protection, and in some people, increase the risk of a heart attack or stroke. Not everybody who takes it will have a catastrophe. That's not the message. The message is more important than that. The message is that older hearts are less forgiving, older kidneys are less forgiving, and older bodies do not handle routine medications the same way they did at 45. Please subscribe today, support this channel, and help more seniors protect their hearts, medications, and independence with clear, honest guidance. Let me start with Raymond from Tampa, Florida, because his story explains why this topic matters so much. Raymond was 72, a retired postal worker, proud, disciplined, and determined not to complain. He had arthritis in both knees, and every morning before breakfast, he took ibuprofen so he could move around without that deep, grinding stiffness. It worked. That was the trap. It worked so well that Raymond stopped thinking of it as a medication and started thinking of it as part of breakfast, like toast or coffee. 2 tablets in the morning, sometimes 2 more in the afternoon if he planned to walk the dog. Harmless, right? That's exactly what he thought. Then little things started changing. Not dramatic things, subtle things. Raymond noticed his socks were leaving deeper marks around his ankles. He felt more winded carrying laundry upstairs. His blood pressure, which had been fairly stable, started creeping higher at home. Nothing terrifying at first, just enough to irritate him. 138 became 148, then 152, then 158. He blamed salt. He blamed stress. He blamed getting older. What he did not blame was the one pill he trusted every day to keep him comfortable. And that's the problem with this medication in older adults. When trouble begins, it usually doesn't announce itself like an emergency. It whispers. It blends in. It wears the disguise of ordinary aging. So let's name it clearly. The pill I'm talking about is ibuprofen, sold under common US brand names like Advil and Motrin, and the warning extends to other non-aspirin NSAID pain pills as well. Naproxen belongs to the same family. Diclofenac belongs to the same family. Celecoxib belongs to the same family. But ibuprofen is the one sitting in millions of American homes, taken for sore backs, bad shoulders, stiff fingers, old sports injuries, and arthritic knees. And because you can buy it without a prescription, many people assume it must be harmless. That assumption is exactly where older adults get into trouble. Now let me be very precise, because fear without clarity is useless. I am not saying that one ibuprofen after a long day of yard work means disaster. I'm not saying every person over 65 must never touch it again. What I am saying is far more practical. If you are taking ibuprofen often, taking it daily, taking higher doses, taking it with blood pressure medicine, taking it with aspirin, taking it while you already have heart disease, swelling, kidney trouble, or heart failure, then this is no longer a casual, over-the-counter decision. This becomes a heart conversation. And most seniors are never told when that line has been crossed. Here is the part your body changes after 65 that nobody explains well enough. As we age, kidneys filter less efficiently. Arteries get stiffer. Blood pressure becomes easier to disturb. Fluid balance becomes more delicate. The heart has less room for error, especially if you already have coronary disease, high blood pressure, diabetes, or a history of smoking. So a pill that seems manageable in a younger adult can become a much bigger problem in an older one. Same bottle, same dose on the label, Completely different physiological consequences. That's why seniors cannot judge a medication by how ordinary it looks on a drugstore shelf. Let me show you danger number 5 first, because this is where many older adults begin to slide into trouble without realizing it. Ibuprofen can raise blood pressure. And if you're thinking, how much could that really matter? Let me tell you about Linda in Columbus, Ohio. Linda was 69, organized, careful, and serious about her morning routine. She checked her blood pressure at home, took her prescribed medication exactly as directed, and kept a beautiful handwritten log. For months, everything looked respectable. Then her numbers started drifting upward. 128 over 76 became 142 over 84. Then 148 over 88. Same cuff, same chair, same time of day. Her doctor reviewed the obvious suspects. Was she eating more sodium? Had she gained weight? Was she under more stress? Had she missed doses? No, and no. Then one question changed everything. What are you taking for pain? Linda had developed shoulder pain from gardening and started taking ibuprofen several times a week, then almost every day. That small change was enough to shift the entire picture. And this is how it happens. NSAIDs can make the body hold on to sodium and water, and they can blunt some of the effects of blood pressure medications. The result is simple but dangerous. Pressure rises. Suddenly, the treatment plan that worked last month stops working this month. And when blood pressure rises in an older adult, this is not just a number problem. It means more strain on the artery walls, more strain on the heart, more work every second of the day. The heart has to push against higher resistance, like a pump trying to move water through a narrowing pipe. For someone who is already managing hypertension, that extra pressure load matters. It matters to the brain. It matters to the kidneys. It matters to the risk of stroke. It matters to the risk of heart failure down the road. Linda thought she had worsening hypertension. What she really had was a medication interaction hiding in plain sight. Now let's move to danger number 4, because this one scares me even more in seniors. Ibuprofen and similar pain pills can cause fluid retention and make heart failure worse. Let me tell you about Charles in St. Louis, Missouri. Charles was 76, a Vietnam veteran, proud of the fact that he still mowed his own lawn. He also had a history of mild heart failure, well controlled for years. Then his arthritis flared up, and he started taking ibuprofen daily because he wanted to stay active. Within weeks, he noticed his shoes feeling tighter. Then sleeping flat became uncomfortable. Then walking from the driveway to the front door started feeling strangely harder. What was happening inside Charles's body was not mysterious. It was mechanical. NSAIDs can make the body retain fluid. That extra fluid has to go somewhere, and when you already have a heart that's working with reduced reserve, even a modest increase in fluid can push you towards swelling, shortness of breath, and worsening heart failure symptoms. Ankles puff up, belly feels fuller, breathing changes. Weight can jump by a few pounds over days, not months. And because older adults often assume swelling is from standing too long or hot weather, the warning gets missed. Charles didn't think my pain pill is affecting my heart. He thought I must be out of shape. But heart failure doesn't always begin with dramatic collapse. Sometimes it begins with sleeping on 2 pillows instead of 1. Sometimes it begins with needing to sit down halfway through the grocery store. Sometimes it begins with that tight feeling around the calves when you pull off your socks at night, and marks stay in the skin longer than they used to. If you are over 65 and using ibuprofen regularly, those changes should never be brushed aside, especially if you already have a diagnosis of heart failure, high blood pressure, or kidney disease. In those people, fluid retention is not an annoyance. It is a warning. And that brings me to danger number 3, the hidden connection between the kidneys and the heart. This is the piece many people have never heard. Your kidneys are not just bathroom organs. They are pressure organs, fluid organs, balance organs. And when NSAIDs reduce blood flow to the kidneys in vulnerable older adults, the effects can boomerang right back to the cardiovascular system fast. Let me tell you about Denise in Phoenix, Arizona. Denise was 71 and took a diuretic for blood pressure, plus another medication to protect her kidneys because she had diabetes. Then chronic back pain led her to add ibuprofen several times a day. She thought she was helping herself stay functional. Instead, she started feeling washed out. Her blood pressure got less predictable. Her legs felt heavy. Her lab work changed. And this is where older adults get trapped. The pain pill seems separate from the heart pill and separate from the kidney pill. But inside the body, they are all part of the same conversation. In some seniors, combining an NSAID with certain blood pressure medications and a diuretic can be especially risky because kidney function can worsen, fluid can shift, and the heart ends up carrying the consequences. Denise did not think she was doing anything dangerous. She thought she was taking something sold next to bandages and cough drops. This is why medication danger in older adults is so often invisible. The harm doesn't always feel like heart pain. Sometimes it feels like fatigue. Sometimes it feels like swelling. Sometimes it looks like stubborn blood pressure. Sometimes it shows up in lab work before symptoms become obvious, and by then the body has already been struggling. That's why seniors can't afford to separate pain management from cardiovascular health. If your kidneys are stressed, your blood pressure control changes. If your fluid balance changes, your heart workload changes. If your heart workload changes, the whole system becomes less stable. One over-the-counter habit can ripple through everything. Now we come to danger number 2, and if you take aspirin for heart protection, you need to hear this part carefully. Ibuprofen can interfere with aspirin's protective antiplatelet effect in certain situations. Let me tell you about Walter in Pittsburgh, Pennsylvania. Walter was 74 and had already had one heart procedure. His cardiologist had him on low-dose aspirin. Every morning, Walter swallowed his baby aspirin with complete faith that he was protecting himself from future trouble. But Walter also had bad hand arthritis, so he chased it with ibuprofen because it helped him open jars, drive comfortably, and grip the steering wheel. Nobody had ever explained that this combination required a real conversation. What Walter didn't know is that aspirin protects the heart in part by affecting how platelets clump. Ibuprofen can get in the way of that benefit when used improperly around aspirin. That does not mean every person taking both is doomed. It means the combination is not something seniors should self-manage casually, especially after a heart attack, stent, or known coronary disease. This is exactly why older adults get misled by convenience. 2 pills from 2 bottles. One is for the heart, one is for pain. Seems simple, but inside the bloodstream it may not be simple at all. And when the heart is already at risk, simple assumptions become dangerous assumptions. Here's what makes that especially important. The people most likely to take aspirin for protection are often the same people most likely to have high blood pressure, narrowed arteries, diabetes, or prior cardiovascular disease. In other words, the very people who have the least room for error are the ones most likely to combine these medications without asking. That is why I tell older adults never to treat an over-the-counter pain pill like a harmless side note when they already have heart history. Once heart disease is on the table, every medication decision becomes part of the main story, not a footnote. And now we arrive at danger number 1, the biggest warning of all. The risk of heart attack or stroke with non-aspirin NSAIDs can begin early, can rise with higher doses and longer use, and does not only apply to people who already know they have heart disease. That is the part that shocks people because most seniors assume the danger only belongs to somebody else. Somebody sicker, somebody in a hospital, somebody with a dramatic history. But the warning is broader than people realize. The older your arteries, the more blood pressure issues you carry, the more medications you take, the less casual this pill becomes. And the tragedy is that the first sign is not always a polite warning. Sometimes the first sign is chest pressure while walking through a parking lot. Sometimes it is sudden shortness of breath. Sometimes it is weakness on one side. Sometimes it is slurred speech. Sometimes it is that feeling people describe as something is very wrong, even before they can put words to it. If that happens, do not sit down and wait to see if it passes. Do not take another pill and go to bed. Do not tell yourself you're overreacting. In the United States, you call 911 immediately, not tomorrow, not after lunch, immediately. Let me stop here and clear up the biggest myth of all, because this myth hurts seniors every day. People believe that if a pill is sold over the counter, it must be gentle, it must be mild, it must be safe for regular use unless the dose is outrageous. That belief is false, especially after 65. Over-the-counter means available without a prescription. It does not mean harmless for your particular heart, kidneys, blood pressure, fluid status, or medication list. Ibuprofen is easy to buy. That is not the same thing as easy for an older body to tolerate. Accessibility is not safety. Shelf placement is not permission. And here is why older adults miss this for so long. The benefit is immediate. The harm is gradual. The knee feels better today. The shoulder feels better today. The back loosens up today. But the blood pressure rises quiet. The swelling is slow. The shortness of breath is explainable. The fatigue seems age-related. The heart strain does not usually arrive with a dramatic sound effect. It builds underneath ordinary life. That is why this pill keeps fooling people. Anything that helps quickly and harms slowly will always be underestimated, especially by good, disciplined people who think, if it were really dangerous, someone would have told me. So who should be most cautious right now? If you are over 65 and have high blood pressure, heart failure, coronary artery disease, a history of heart attack, a history of stroke, kidney disease, diabetes, ankle swelling, or you take aspirin, a diuretic, or multiple heart medications, this video is about you directly. If you are taking ibuprofen most days of the week, this video is about you. If you increased your dose because the old dose stopped helping, this video is about you. If you are using pain pills to stay active but noticing higher blood pressure or fluid retention, this video is absolutely about you. Now let's talk about what to do, because fear without action helps nobody. First, do not panic, and do not suddenly stop a prescribed medication from a surgeon, primary care doctor, or specialist without asking why it was recommended. But if you are taking ibuprofen on your own most days, today is the day to audit that habit honestly. How often are you taking it? What dose are you taking? Do you take it with aspirin? Do you take it while on blood pressure medicine? Have your home blood pressure numbers changed? Have your shoes gotten tighter? Have your rings become harder to remove? Has your breathing changed in the last month? Second, look for patterns, because your body often tells the truth before your lab work does. Check your ankles at night. Watch for new puffiness around the socks. Weigh yourself several mornings in a row if you have a history of heart failure. Pay attention to whether you need more pillows. Notice whether walking uphill suddenly feels harder without another obvious reason. And if your home blood pressure has been harder to control since your pain pill routine increased, do not brush that off. A pain solution that destabilizes the heart is not a full solution. It's a trade you may not want to keep making. Third, bring every bottle into the light. Every single one. Prescription bottles, over-the-counter pain relievers, sleep aids, cold medicines, samples from the medicine drawer, old bottles in the bathroom cabinet. Take them to your doctor or pharmacist and ask one simple question. Which of these is hardest on my heart, blood pressure, kidneys, or fluid balance? You would be amazed how often seniors discover the problem is not one dramatic prescription, but one familiar over-the-counter habit that nobody ever reviewed. Medication safety after 65 is not about intelligence. It is about visibility. You can't protect yourself from interactions you've never been shown. Fourth, talk about alternatives. Sometimes the safer answer for chronic pain is acetaminophen. Sometimes it is a topical NSAID gel rather than regular pills. Sometimes it is physical therapy, heat, ice, better footwear, weight reduction, stretching, a joint injection, or changing how pain is treated altogether. Sometimes the right answer is still an NSAID, but at the lowest effective dose for the shortest possible time under medical supervision. The point is not that every pain pill must disappear. The point is that older adults deserve a plan, not a reflex. A plan considers the heart. A reflex only considers the pain. And please hear me on this because it matters. Some seniors hear information like this and think, fine, I'll just switch to another one on my own. No, do not play musical chairs with NSAIDs. Naproxen may be viewed differently in some situations. Celecoxib may be considered in some situations. Topical treatments may be preferable in some situations, but different does not mean safe for me. And it certainly does not mean safe because I guessed. Your medical history decides what is reasonable. Your heart history decides. Your kidney function decides. Your current medication list decides. Guessing is not a treatment strategy. Let me tell you about Nancy in Des Moines, Iowa, because her story brings all of this together. Nancy was 73, widowed, independent, fiercely private, and unwilling to bother the doctor. She had knee pain, high blood pressure, and mild swelling she blamed on summer heat. She took ibuprofen most afternoons so she could keep up with church, grocery shopping, and grandkids. Her blood pressure began climbing. Her shoes felt tight. She felt older all of a sudden. When her medications were finally reviewed, the pattern became obvious. Her pain routine had been working against her blood pressure control and fluid balance. Once the plan changed, the swelling improved, her numbers settled, and she felt steadier. What Nancy needed was not shame. What she needed was a full explanation. Most older adults do not misuse these pills because they are careless. They misuse them because they are trying to stay functional, trying not to complain, trying to remain independent, and trying to manage pain without feeling like a burden. I understand that. But independence is not doing everything alone. Real independence is having accurate information early enough to avoid preventable harm. That is what protects mobility. That is what protects confidence. That is what protects the heart. So let me give you the bottom line in plain English. If you are over 65, ibuprofen is not just a pain pill anymore. It is a medication that can raise blood pressure, make the body retain fluid, worsen heart failure, stress the kidneys, interfere with aspirin's heart protection in certain situations, and increase the risk of heart attack or stroke, especially with higher doses, frequent use, longer use, or existing cardiovascular disease. That does not mean panic. It means respect. It means you stop treating the bottle like a harmless convenience item and start treating it like a real medical decision. If you've been taking it often, review it. If you have swelling, review it. If your pressure is climbing, review it. If you're on aspirin, review it. If you have heart disease, kidney disease, or heart failure, review it today, not next month. And if you ever develop chest pain, shortness of breath, sudden weakness on one side, or slurred speech, you do not wait. You call 911. Your heart cannot afford delayed decisions disguised as toughness. Too many older adults try to outweight symptoms that should have been treated as emergencies. Your pain matters. I want to be clear about that. Arthritis pain is real. Back pain is real. Shoulder pain is real. But the goal is not to feel better for 6 hours while quietly making your cardiovascular system pay the price for 6 months. The goal is to relieve pain without sacrificing blood pressure control, breathing, kidney function, or heart safety, and that balance becomes more important every year after 65. You deserve relief that does not blindside you. So tonight, before you go to bed, look at the bottle. Ask yourself how often you're really taking it. Ask yourself what has changed in your body since that routine began. Ask yourself whether anybody has reviewed it in the context of your age, your heart, your blood pressure, and your full medication list. Because the most dangerous pill is often the one you stopped respecting years ago, simply because it became familiar. Take care of your heart. Protect your independence. Respect what aging physiology changes. And if this video helped you see your medicine cabinet differently, subscribe, share it with another older adult, and bring this conversation to your next doctor or pharmacist visit. The right pain plan should help you live longer and feel better, not force your heart to absorb hidden damage in silence, one tablet at a time.